occurs due to the hypersecretion of growth hormone in children before closure of epiphysis. It usually caused due to the tumor of pituitary gland. Some of the clinical features are there will be abnormal height, that is, the person can grow up to 6.5 to 9 feet. They have a large hands and feet. There is a bilateral gynecomastia, and there will be loss of libido, and there can be impotence. Then hyperglycemia will be caused by growth hormone, which leads to excess insulin secretion. Overactivity of beta cells of pancreas ultimately leads to degeneration of these cells and deficiency of insulin, resulting in diabetes mellitus. The tumor of pituitary gland itself causes headache and visual disturbances. Sometimes there can be bitemporal hemianopia. If untreated, gigantism ends in hypopituitarism due to destruction of the gland by the tumor. Treatment of acromegaly or gigantism is usually irradiation of the tumor, if at all it is caused due to the tumor. Acromegaly. This occurs due to the hypersecretion of growth hormone in adults after the closure of epiphysis. It can be caused by extrapituitary as well as intrapituitary growth hormone secreting tumors and by hypothalamic tumors that secrete growth hormone releasing hormone. The height will not be increased, but bones become thicker and soft tissues continues to grow. Hypersecretion of growth hormone is accompanied by hypersecretion of prolactin in 20 to 40% of the patients with acromegaly. Some of the clinical features of acromegaly are hands and feet are enlarged, especially the acral parts, that is peripheral parts, and there will be protrusion of the lower jaw due to the elongation and widening of the mandible, which is also called as prognathism. There will be overgrowth of malar, frontal, and facial bones, combines with prognathism to produce coarse facial features called as acromegalic faces. The changes in the vertebra will also lead to condition called as hunchback, that is kyphosis. The skeletal changes predisposes to osteoarthritis, and excessive growth of the internal organs lead to cardiomegaly, hepatomegaly, splenomegaly, and renomegaly. There will be excessive growth of body hair, so there can be bitemporal hemianopia, which occurs because of the optic chiasma is compressed due to the pituitary tumor. In 4%, there will be gynecomastia with or without lactation. So treatment, the benign tumor will be usually treated by surgery followed by irradiation, and malignant tumors, they are usually treated by irradiation and surgery usually not done. This picture shows some of the clinical features of acromegaly, where it is showing prognathism and acromegalic faces, increased hair growth, that is hirsutism, gynecomastia because of the increased prolactin levels. There can be osteoarthritis, importantly enlarged hand and feet. There can be organomegalies like cardiomegaly, splenomegaly, renomegaly, and hypertension. And there can be osteoarthritic changes, that is vertebral changes, which leads to kyphosis, and there can be visual field defects like bitemporal hemianopia. Dwarfism. Some of the endocrinal causes of dwarfism are pituitary dwarf, where it occurs because of the growth hormone deficiency. It is due to the growth hormone deficiency secondary to decrease in the growth hormone releasing hormone. Some of the characteristic features are plumpiness, that is fatness, immature faces, and small genitalia, delicate extremities, delayed skeletal and dental development. And there can be hypothyroid dwarf, which occurs because of the deficiency of thyroid hormone in children, which is also called as cretinism, and it is due to the thyroid hormone deficiency. The difference between pituitary and hypothyroid dwarf is given in the table. The genetic cause of Laron dwarfism, that is also called as growth hormone insensitivity syndrome. Here the plasma growth hormone levels is normal or elevated, but the growth hormone receptors are unresponsive. So this occurs due to the mutation in the gene for the receptors. And there is also marked decrease in the plasma levels of insulin-like growth factors 1 in this condition. So this table shows some of the difference between pituitary dwarf and hypothyroid dwarf, which is also called as cretin. Pituitary dwarfism occurs due to the growth hormone deficiency in childhood, and cretinism occurs due to the thyroid hormone deficiency in children less than 2 years of age. The mental activity is normal in pituitary, where the cretin dwarf is mentally retarded. The pituitary dwarf is sexually mature and cretin is sexually immature. In pituitary dwarf, different parts of the body are proportionate, whereas in cretinism, the different parts of the body are disproportionate. That is, upper segment is more compared to the lower segment. African pygmies, they have a normal plasma growth hormone levels. Plasma concentration of growth hormone binding protein decreases here. The plasma insulin growth factor 1 concentration fails to increase at the time of puberty. Some of the nutritional causes like marasmus and rickets also lead to dwarfism. Achondroplasia, it is an autosomal dominant condition caused by mutation in the gene that codes for the fibroblast growth factor receptor. So there is a faulty endochondral ossification resulting in dwarfism. Here, subject is mentally sound, and it the features are abnormal body proportions, like they have a large head and short limbs.